Welcome to part 5, Doctor Diagnosis. This workspace will deal with the circulatory system. The circulatory system can also be called the cardiovascular system or the vascular system. So when you're looking at other resources, make sure you're aware that those are kind of used interchangeably. There is a handful. This is probably your biggest workspace to date on Doctor Diagnosis, and that's because we're not just talking about the heart, which is super important. We're also talking about vessels like arteries and veins and how blood moves. We're also talking about capillary beds, which happens to be what gets blood and all the good stuff in your blood to your organs so they can use that so they can function. But we also are going to talk about blood itself and the idea that we have blood types and that we have you can have a blood transfusion and how that could go wrong. So there's all kinds of information in this section that has to do and tie together through that cardiovascular system. So remember, I've supplied to you part 5 of the project. You can see there's a handful of outcomes that are going to be there. You're also going to have a lot of vocabulary. So again, make sure you're looking at that. You might want to break it up into 2 parts. You might want to look at just the heart and then just blood and how blood works. But it doesn't matter. Whatever works best for you. You're also looking at blood pressures and stuff. So there is 9 different things that you have to do in this part of the project. Some are simpler, some are more complex. Some require flowcharts and diagrams. Just make sure you chat with your teacher about how they want you to do those kinds of things. Maybe they want it electronically. Maybe they just want you to scan it in or take a picture with your phone. Maybe they're happy with it on a paper and you submitting it in a different kind of way. So chat with them about how they want that to look. So a handful of videos here too. I've got a circulation introduction. Make sure you check out the Google Slides. If you want to download that, print that, make sure you're adding to that. Blood and blood types, capillary fluid exchange, so what's happening at the capillary bed, the pathway of blood through the heart, how the heart actually beats, so the action of the heart, then cardiac output and this idea of blood pressure. There is a video on a heart dissection. Now, if you're fortunate enough, your teacher might be able to get you some hearts and you might be able to do a dissection. If not, this is a great video to watch anyway because he does a really good job at dissecting it. 2 pieces of textbook there, circulation system and circulation and immunity kind of tied together with blood, and then the glossary as well for you. So if you take a look at what pieces of evidence are required of you, lots of vocab words, like I said, maybe a good thing to tackle first before you even try to tackle the content in the videos. The heartbeat, some of it's really simple step-by-step. Some of it's just comparing and contrasting, looking at blood flow, looking at blood vessels, capillaries, blood types. There's that negative feedback loop. There's those conditions. Now here you can look at it in a bunch of different ways. You could look at cardiac conditions. You could look at blood conditions. You could look at things that affect just your vessels. Whatever you want, you could have more than one condition if you find a couple or a couple negative feedback loops as well. There's those patient files. Circulatory Cindy has shown up. She wants to know what's wrong. So try to figure out what you think might be happening with her. There is an optional lab called the heart dissection. I kind of alluded to that. Check with your teacher. Maybe they just want you to watch the video and work on the lab. Super neat thing to do. If you can't get your hands on it, that's okay too. Also, that's missing in here, but there's going to be a lab right here that's a blood pressure lab. And that one doesn't require as much fancy equipment or a specimen for that matter. There's also an outcome quiz that you need to make sure you're getting organized for. There's that optional lab rubric and an assessment rubric, always checking back. Where do I fit? Where do I belong? How can this all fit in with my final product? How can I start tying this all together? Because we're getting close to the end.